Bonjour Montréal, tous qui sont d'ici. Je suis ravie d'être de retour à Montréal parce que j'ai vécu ici pendant 6 ans et j'adore les Montréalais. For those who understand English, French. I used to live in Montreal for 6 years, and Montreal was my second home. I left Yugoslavia and moved to Montreal, and I love Montreal, so I say thank you for them. Eyebrows, the purpose of eyebrows is to frame the eye, enhance facial features, and also provide the expression, quizzical brow. Eyebrows also can determine a style. If you look at the style of 30s, the thin arched eyebrow determined the era in a style. 50s, thicker eyebrow, and in 80s and 90s is thinner eyebrow. So when we look at an eyebrow, we just don't think a few hairs on a face, but rather facial feature style and a function. And one of the function is to keep the sweat running down into our eyes. Indication for eyebrow transplant can be burn. Someone can burn themselves and end up with a scar and need eyebrow transplant. Scar from the injury, piercing, or direct brow lift. Later in my presentation, I will show you a photograph of a person who had the direct eyebrow lift. Alopecia areata, low density due to plucking or waxing can also be an indication for eyebrow transplant. And congenital absence, which would be either uneven or thin eyebrows. The uniqueness about eyebrows is that hair quality is different than the hair we find on our head. Interestingly enough, in Caucasians, the eyebrow consists of the stronger hair comparing to the hair we find on the head, and in Asians is the opposite. Hair angle is very flat to the scalp or forehead, almost parallel to the skin, comparing to the hair angle on the top of our head, where it varies from 10 to 45 degrees. And hair direction is, there's a two-part to the eyebrow. Medial part, it is just above the nose, and the hair grows upwards, and then the lateral part of the eyebrow where the hair grows crisscross, the upper portion grows down and the bottom portion grows up, the other way known as a fishbone. The shape of the eyebrow can change from female to male shape and show differences. Female shape is thinner and male is thicker. We're not talking about plucking eyebrows, just the original eyebrow will be usually thinner in female. And the female eyebrow would represent more curve, while eyebrow in male is more straight. I just include a few images to show you how the shape of the eyebrow in female can vary, and then in male too, from different thickness to different arch. We also find a difference in eyebrow shape looking at the different ethnicities. I compare Caucasian and Asian because they are mostly obvious. In Caucasian, they are thinner and straight. In Asian, they have a little bit thicker lateral portion. So if you see on the images, Brad Pitt would find, you will look at his eyebrow is more straight, and the Asian eyebrow has a thicker lateral portion. In a consultation for eyebrow transplant, it is important to mention that the eyebrow may not be symmetrical, and the patient has to be aware of that before undergoing eyebrow transplantation. Also, we have to mention that the hair will grow long and would need to be trimmed at least 1 to 3 times a week, depending on how fast the hair grows. But also, we can explain to a patient that sometimes it may take several years, and then the hair may show slowing down in a growth because of the recipient dominance. And another important thing to mention during the eyebrow consultation is that we may not achieve expected density. Sometimes people desire really thick eyebrows, or the eyebrow may not grow because we are transplanting mostly one hairs. And so in that regard, we have to make sure that we inform the patient that it may require another session. I worked with Dr. Lam, and he usually has this expression that he says that what we say to the patient during the consultation is education, but we can say the same thing 3 months down the road, and then it would be an excuse. So you better use that time for education. The principles of eyebrow transplant is that the basic principle of taking hair from the back, transplanting an eyebrow is the same, but we have to select donor hair according to the hair caliber. We're looking at thicker hair. We are going to look through the donor area until we find a hair, let's say in Caucasian, that is coarser. Sometimes it can be in a temple, sometimes it can be high. If we're, let's say, restoring female eyebrows, it can be very high on the back of the head. The closer we go to the occipital area and the neck, hair may be finer, so in Caucasians we may avoid that, and that is exactly what we may be looking for Asians. We also look for 1 and 2 hair follicular units. Occasionally we can use 3 follicular units in male patients. And another principle in hair transplantation for the eyebrow is to look at hair growth in the eyebrow and make sure that we direct hair properly and look at the curve, and I will explain this a little later about how to make sure that the curve in each graft is facing the scalp. Eyebrow proportions, as you see here, just kind of guidelines how to design the eyebrow, because there's a definitely little arch, and looking at that arch we have to direct our hair growth and grafts. As you see, the A line is the inside of the eye, B is the lateral portion of the iris, and the C is where the eyebrow should finish. Just small image or quick look at the difference between a female and male eyebrow. Male eyebrow will be flatter and more thick. Donor selection and site creation, we're going to look for the appropriate caliber and follicular unit distribution. We're going to avoid the areas where we have most of the 3 and 4 follicular units graft, and find the areas where the hair is coarse and are also mostly contain 1 and 2 follicular units. Sites are usually made with 19, 20, 21 gauge needle. Area in our office, area is tumesced to provide, in order for us to put more sites in one area, we tumesced the area so the skin slightly stretches. We can place more hairs, and once the tumescence subsides, we achieve higher density that way. And insertion of the needle has to be really flat with the scalp, and we bend our needle so that we bend it at a 90-degree angle so the needle can come flat, and my hand is away from the scalp and allows entry point to be parallel to the skin. I design little, just kind of bear with me, how we can distribute our grafts, and mostly we use 1 hair follicular units, what you see with the blue arrows, and always at the periphery of the eyebrow. In the inside middle insert portion we can put 2 follicular units to provide a density, and occasionally we can use in the same area 3 follicular units. The core of the eyebrow will be designed and populated with 2 follicular units so that it gives the core along which the hair will converge from the upper and lower portion. So 1 hair follicular units are coming from the above and below. They provide a thin outline, nice blending, and the definition of the eyebrow is created with 2 follicular units. I also try to demonstrate how important it is to look at the hair angle and look at the portion of this curl closer to the arrow, and it's showing how hair has to curve up, curve down, and I hope this is clear enough. This is the crucial part in hair transplantation of the eyebrow. If you have your hair angles pointing away from the scalp or in a wrong direction, they cannot be camouflaged. They cannot do anything. If you perform eyebrow incorrectly, they cannot do anything to camouflage